very warm welcome to all of our audiences. I am Sharanya, Strategy Analyst at Tsaaro, and today we are joined by Aruna Vaz, a seasoned leader in enterprise risk management and compliance. With over 20 years of international experience across countries like Indonesia, Singapore, Hong Kong, UK, and even the UAE, she has led major initiatives in areas like solvency, GDPR, operational risk, privacy, and ESG. Her leadership roles in at M2, the cryptocurrency exchange, Astadium Healthcare, and MNG showcase her strong track record in building and strengthening risk and control frameworks. We are so happy to have you with us today. Thank you for making the time for us.
Thank you, Sharanya, for having me on the podcast.
To begin, I would really like for you to break a few things down for our audience. I know it might be very rudimentary, but we'd really like to know what are the regulatory differences between when it comes to data privacy and cybersecurity in the Middle East when compared to India and the EU.
Great. Yeah. Thank you for that question. That's a good start, actually, to the podcast. Given that I've worked in all three regions now, maybe the response will also be something that will be useful for individuals. So let me start with Middle East, Sharanya. In Middle East, basically, data privacy and cybersecurity are maturing very rapidly. The governments here are rolling out GDPR-style laws. Take, for example, Bahrain. Since 2019, Saudi Arabia, they first enforced in 2023, then they revised in 2024. Qatar and the UAE, Federal Law 2021, there are sectorial regulations, etc. All of these are promoting awareness before enforcement and embedding AI ethics and resilience into smart city, fintech projects, etc. Cybersecurity frameworks are also strengthening. Saudi Arabia's National Cybersecurity Strategy 2.0, it's risk-based. UAE includes zero trust initiatives, smart city resilience. There is also growing focus on AI ethics and third-party management, robust encryption, especially in the UAE. As per Gulf News, in May 2025, a leading bank in the UAE, I'm not going to take the name, you guys can look it up on Google, but a leading bank in the UAE has started using predictive AI systems to detect fraud in real time, combining tech with strengthened PDPL compliance. So basically the sanctions check, fraud detection, etc. is happening in real time using AI. Now, when I come to India, our home ground, basically, it is building its foundation when it comes to DPDPA. Yeah, the DPDPA is fully in force since 2025, early 2025 this year. It mainly focuses on digital personal data, mandating consent-based processing, granting rights like access, correction, deletion, penalizing violators, and forming a data protection board. On cybersecurity front, we all know CERT in remains India's central incident response and guideline body. But when we talk about EU continues to remain the gold standard with GDPR. Yeah, GDPR is considered the Bible for privacy across jurisdictions. It's got deep individual protection, multi-layered cybersecurity laws like NIS2. Uh, Basically, NIS2 is the updated cybersecurity mandate and incident response across sectors. Also, DORA currently talks about resilience in financial entities and has been effective from January 2025. So if you look at the three regions, all three regions have made tremendous progress when it comes to cybersecurity and data privacy. They've got a lot of laws and regulations, but whilst EU is in a mode where organizations get penalized for violating, India is still building its data privacy framework and policy and implementing the same. UAE is in a mode where basically they're promoting awareness before any sort of enforcement. So that's basically the clear line of difference that I see between the three geographies.
So there's a little bit of hand-holding happening across the Middle East.
Yes, yes, it is. It is, and it's very interesting to say. And I say this in a number of forums. The regulators here that I have worked with, they call you up and they say, hey, there's an issue that we've spotted. Let's work together to resolve this. Before they say, hey, there's an issue, so we're going to send you a notification and you're going to be penalized and stuff like that. So I think there is a lot of hand-holding, there's a lot of awareness, there's a lot of partnering and collaboration that's happening to ensure that organizations understand what are the requirements of different regulations and they implement the right frameworks. So that's my take on Middle East.
That sounds lovely, actually. You have worked in healthcare quite a bit. Your work with Aster Healthcare has been quite prominent. And in healthcare, we are dealing with a lot of sensitive data. So, drawing from your experience, what do you think makes risk management in healthcare especially challenging, considering you're working in the Middle East?
Okay, so healthcare and risk management in healthcare is complex, yeah. But in the Middle East, it's not only complex, it's unique and it's also evolving, yeah. From my experience, what I've seen firsthand is how this region's rapid growth, regulatory transformation, demographic diversity, for example, it creates a highly dynamic risk environment, yeah. So, as a risk manager, one key challenge that most risk managers in healthcare in the Middle East face is regulatory fragmentation and the pace of change. So, countries like UAE, countries like Saudi, they're actively reforming healthcare and data governance frameworks. Every day, you would read or hear about introduction of digital health laws, data protection acts, mandatory insurance schemes, all of these, yeah. But even with these changes or these frameworks that are coming in, these frameworks significantly vary between jurisdictions. So, for example, Dubai Healthcare City versus DIFC versus federal laws, there'd be slight nuances, slight differences. Yeah. So, as a risk manager, one has to constantly monitor shifting compliance landscape and adjust our controls accordingly. So, that's the first challenge that I see. Secondly, cybersecurity and patient data privacy are growing concerns. So, as we understand with healthcare, we have a lot of patient sensitive information that we're dealing with. Yeah. So, more hospitals shift to electronic medical records, AI based diagnostics. Yeah. So, the sector becomes a bigger target for cyber crimes, bigger target for cyber threats. For example, ransomware attacks in regional hospitals, it may not always be public, but they push boards and board members to prioritize cyber security as not only an IT issue but also a clinical risk, because they know that it is really key for us to kind of look at this. Another challenge is managing operational risk. Yeah, so during especially during instances like COVID, for example, medical workforce shortage, you know that the Middle East heavily relies on expats. So high attrition, visa dependency, geopolitical events, these can disrupt staffing models, directly impacting patient care as well as service quality. The other thing that I see is cultural and linguistic diversity that also adds to complexity for patient safety and communication. Um Asta, for example, they serve patients over 100 nationalities, yeah, across the GCC. So, as a healthcare provider, serving so many patients, so many nationalities, ensuring consistent standard of care is key for them, yeah. They also ensure that there is diverse health literacy levels and the expectations. It's a fine balance basically, and it's a delicate balance for organizations to maintain. Lastly, I think the challenge I see as a risk manager is the pressure to adopt technology and new technology fast. Yeah, like for example, telemedicine or AI diagnostics. These can outpace governance structures. It creates strategic risk around ethical AI use, patient consent, and quality assurance. And if you don't catch this bus fast, basically you become obsolete as an entity. Yeah. So when the UAE introduced its federal data privacy law in 2022, that's the PDPL, many healthcare providers rapidly said that they're going to start updating their patient consent processes, data sharing agreements, and breach response protocols. In short, risk management in healthcare is about staying agile. It's not only about compliance, it's about embedding resilience into fast moving, tech driven, and multi jurisdiction operations. So, only then can you be a risk manager. So, it's like an agile risk manager for an industry that has to stay agile, otherwise, it's going to be outdated.
Understood. So, one thing that comes out of all of this is how do you actually balance regulatory compliance with this need for rapid digital upgradation?
Yeah. Uh, so balancing regulatory compliance is one of the biggest strategic tensions in the Middle East, especially in healthcare today. Yeah, the region is heavily invested in healthcare, AI diagnostics, electronic health records, telemedicine, wearable integration. All of these are significant innovations in healthcare, but regulatory frameworks are still evolving or are still trying to catch up. So, from my experience, this balance starts with proactive risk mapping during digital planning. What I mean by that is compliance isn't an afterthought, but built into the transformation roadmap right from the start. So you invite your risk and compliance people to the dinner party right at the beginning. Instead of there's something wrong and there's an issue or there's a crisis, and then you call your risk and compliance teams. So I think that is something that we should avoid. For example, when rolling out AI-driven triage tools or remote consultation platforms in the UAE, organizations are needed to align with UAE's DPDL. But they also need to comply with local health authority regulations, like the DHA, for example. In practice, that means securing patient consent mechanisms, protecting data in cross-border cloud environments, and ensuring clinical validation of AI outputs. If I take an example of Saudi Arabia is working under the Vision 2030. The Ministry of Health is pushing aggressive digital health reforms. But with Saudi Arabia's Saudi Data and Artificial Authority, SDAIA as we call it, it's enforcing PDPL. So healthcare providers must now get explicit approvals for international data transfers, something that can delay cloud migrations, right? Or AI partnerships, unless we don't manage these early. The key is, earlier I said the key is for risk managers to be agile. But now for us, it's agile and it's governance agility as well. So we need to ensure cross-digital governance boards, bringing together people together to have that collaborative discussion. So for example, you bring your compliance team, your IT, your clinical, your legal teams. All of them need to come together to ensure that every innovation passes not only through a regulatory filter, but also through a clinical lens. So we're looking at it from both perspectives. And frankly, the region is shifting from a checklist compliance mindset to a resilience mindset. Instead of asking, are we compliant? The smarter question now to ask is, this innovation that we want to implement, will it withstand, say, a regulatory audit? Or will it withstand a cyber breach? And will still deliver safer patient outcomes for us? Yeah. Quick examples I can talk of. If you've heard of Cleveland Clinic in Abu Dhabi, it has an integrated AI-powered diagnostics. So while ensuring it is DHA and federal compliant, it ensures that onshore data centers have multi-layered protection. Another example in Saudi would be SNEA Virtual Hospital. They've rolled out a remote ICU monitoring across regions, but partnered so closely with regulators so that they ensure they define remote consent, e-prescription, and ICU standards as per regulatory framework. Yeah. What these examples tell us, they basically tell us that successful healthcare organizations in the Middle East aren't slowing down innovation. They are embracing compliance as a growth enabler and not a blocker. And that's the reason why privacy risk compliance functions need to be, as I said earlier, party to the dinner rather than coming later, like basically once a crisis or an event happens. So that's how we can strike the right balance as well as be the right partners as well.
Understood. Thank you so much for that.